Good afternoon, my name is Lissettte and my topic is adult rhinosinusitis. The definition is that it's one of the most common conditions for which patients seek medical care. Rhinosinusitis or sinusitis is a condition involving inflammation in one or more of the paranasal sinuses. Subtypes of rhinosinusitis include acute, subacute, recurrent acute, and chronic.
Is sinusitis or rhinosinusitis, which often causes a dull, pressurized headache or facial pain for sufferers. Rhinosinusitis can affect any of the paranasal sinuses, the maxillary, frontal, ethmoid, or sphenoid.
Acute rhinosinusitis is further specified as bacterial or viral. Most cases of acute rhinosinusitis are caused by viral infections associated with the common cold. Symptomatic treatment with analgesics, decongestants, and saline nasal irrigation is appropriate in patients who present with non-severe symptoms.
The mucosa becomes increasingly edematous and the inflammation gradually blocks mucus outflow. The sinus becomes blocked with secretions that in time will become mucopurulent.
In application in medicine, we have other types that are chronic rhinosinusitis, that is characterized by mucosal inflammation affecting both the nasal cavity and paranasal sinuses. Its causes are potentially numerous, disparate, and frequently overlapping. The more common conditions that are associated with CRS are perennial allergic and non-allergic rhinitis, nasal polyps, and anatomical mechanical obstruction.
Life is uncomfortable with facial pain and pressure, congestion, postnasal drainage, and maybe headache, fever, fatigue, and cough, not to mention halitosis. The culprit? 8 cavities in the human skull called sinuses.
The bandage we have are treatments that are analgesics, saline irrigation, topical glucocorticoids, topical and oral decongestant, antihistamines, and mucolytics.
Treatments for rhinosinusitis aim to lessen symptoms, reduce sinus inflammation, treat infection, promote mucus clearance, maintain open sinuses, and prevent complications. Treatments include remedies or actions to provide relief, medications, drug therapy, and surgery.
In disadvantage, we have there are complications that are meningitis, cellulitis of the eye, and cellulitis around the eye, and permanent loss of smell.
A whole host of factors contribute to chronic sinusitis. Anatomical factors such as a deviated septum, narrow ostia, and nasal polyps.
In short, in Ecuador, we have that in Ecuador is a very common disease, rhinosinusitis or sinusitis is a condition involving inflammation in one or more paranasal sinuses.
Is sinusitis or rhinosinusitis, which often causes a dull, pressurized headache or facial pain for sufferers. Rhinosinusitis can affect any of the paranasal sinuses,